What is a unit? How many units am I going to need? Is there a difference between Dysport units and Botox units? Hi, I'm Dr. Messina. These are very common questions asked by patients who are interested in getting a botulinum toxin injection. Today, we're going to go over what a unit is, the differences between those two medications, and how many units you might expect to get during your treatment. Basically, a unit is nothing more than a measure of dosage. We're all quite familiar with milligrams. We know that a baby aspirin is 81 milligrams. However, when it comes to units, it's a much less known term. It's just basically the dosage. So we have 5 units of Dysport versus 10 units of Dysport. Well, the person who got 10 units just got a higher dosage, and that's really all it means. Now, what are the differences between Botox dosing and Dysport dosing? Well, Dysport is a smaller molecule. So for every 1 unit of Botox, we have to give 2.5 to 3 units of Dysport. It does not mean that Dysport is weaker. It's just the chemical composition of that medication requires 3 units to every 1. Now, how many units can we expect to get? Very variable. It's based on age, how severe your rhytids are, the muscular strength, and the size of the area that's going to be injected. But we can get fairly close. If you want to treat the glabella area, which is the area between your eyes for those bothersome 11 lines, in general, 20 units does the trick. 20 units of Botox or 60 units of Dysport. Forehead is a little more variable because different size foreheads. Some people are very lucky and they only make a single central rhytid. Some have 3 and 4 rows. If you're lucky and you have one of the smaller foreheads with a single rhytid, you'll probably take 10 units of Botox or 30 units of Dysport, up to probably 20 units of Botox and 60 units of Dysport to cover a forehead that's wide and has extensive rhytids. Now your crow's feet, the lateral rhytids of the eye. Some people have a single rhytid that comes out of the corner of the eye. They're the luckiest. 2 units per side of Botox, 6 of Dysport. However, it's more common to have what we call as a fan pattern. In other words, like rays of sunshine coming out of the corners of the eye. You might need up to 12 units per side. So in general, it's not unheard of to have a woman require 50 units for all 3 areas of Botox, or 150 units of Dysport. Men require a little bit more, 60 to 70 units in some instances of Botox. Well, I hope this was helpful. Feel free to send any questions you might have, and have a great day.